Morning all. Today we are going to discuss about the angina. It is the another disease comes under cardiovascular system disorders. Under this topic, students will be able to understand about the angina, pathophysiology of angina, atherosclerosis, pathophysiology of atherosclerosis, pharmacotherapy of angina, and pharmacotherapy of atherosclerosis. So let's discuss first about definition of angina. Angina is a result of myocardial ischemia caused by an imbalance between myocardial blood supply and oxygen demand. It is a common presenting symptoms that is chest pain among patients with coronary artery diseases. A type of chest pain are pressure or through the discomfort. You can see in this image that insufficient blood flow to the heart muscle from narrowing of coronary artery may cause angina or chest pain. You can see in the arteries image there is a plaque formation in the coronary artery which causes a blocking of blood supply to the heart that causing a chest pain, and this chest pain is a symptoms of angina pectoris. A type of angina. Angina is classified broadly as stable or unstable, depending on its pattern of occurrence and severity. You can see in this image that reversible angina and progressive angina. Reversible angina from increased demand on heart, progressive angina associated with heart attack. So basically there is a two type of angina, that is stable and unstable. Stable angina occurs when increased physical activity such as hurrying across a street or climbing a long stairs, which creates a greater demand for oxygen rich blood to reach heart tissue. Unstable angina occurs with lesser degrees of exertion or while at rest. Unstable angina that occurs at rest is the most serious form. Formation of a blood clot at the site of a ruptured plaque is in a coronary artery. Now let's discuss about pathophysiology. Myocardial ischemia develops when coronary blood flow becomes inadequate to meet myocardial oxygen demand. This causes myocardial cells to switch from aerobic to anaerobic metabolism with a progressive impairment of metabolic, mechanical, and electrical functions. Studies have shown that adenosine may be the main chemical mediators of anginal pain. During ischemia, ATP is degraded to adenosine, which, after diffusion to the extracellular space, causes arteriolar dilation and angina pain. Clinical presentation: angina is a symptom of ischemic heart disease. Episodes of stable angina typically are brought on by exertion or emotion and are relieved with rest. An attack of stable angina lasts from 1 to 5 minutes and is described as squeezing, choking, smothering, or crushing pressure in the chest. Angina pain may radiate to the shoulders, arms, back, neck, or jaw. Patients with atherosclerosis also may experience sweating, shortening of breath, that is also called as dyspnea. Now, in this image, we can see a clinical presentation of angina. Angina, a type of temporary chest pain, pressure, or discomfort. It caused due to narrowed artery or due to ischemia, or the reason is that the muscle of the heart is not receiving enough oxygen due to a narrowed coronary artery. Now, in this image, the right side of the image, you can see a typical distribution of referred pain in a angina patient. Diagnosis: a diagnosis of stable angina is based primarily on symptoms such as chest pain. A diagnosis of unstable angina is made when there is new onset angina that is severe or frequent, chronic stable angina who develop more frequent, severe, prolonged, or more easily triggered episodes, and angina at rest. Diagnostic test and procedures. First is electrocardiogram, that is ECG. It detects and records the electrical activity of the heart. Certain electrical patterns that the ECG detect can suggest whether CAT, that is coronary artery disease, is likely. However, some people with angina have a normal ECG. The ECG is usually normal between attacks. During an attack, there may be a transient ST segment depression. If the angina is provoked by exertion, an exercise stress ECG should be performed. Second diagnostic test are stress ECG testing. Typically, this test involves taking an electrocardiogram before, during, and after exercise on a treadmill or stationary bicycle. Patients who are at risk for a coronary event with exercise are still given a drug to increase the heart rate. Third diagnostic test or coronary angiogram is obtained by injecting contrast material into the bloodstream and taking X-ray of the coronary arteries. This enables the physicians to see blockage, malformations, and stenosis in the vessels. Fourth is blood test. Blood test check the levels of certain fat, cholesterol, sugar, and protein in blood. Abnormal levels may indicate risk factor for coronary artery disease. Some studies suggest that high level of C-reactive protein in the blood may increase the risk for coronary artery disease and heart attack. Goals of treatment. All treatments for people with coronary artery disease have the same goals: to decrease the effect of the disease on the quality of life and alleviate symptoms, to reduce mortality due to CAD progression. Drug therapy. Currently, there are three main types of drugs used. Those are nitrates, beta blockers, and calcium channel blockers. So first drug, that is nitrates. Nitrates or beta blockers are usually preferred for initial treatment of angina, and calcium channel blockers may be added if needed. Nitrates. It improves blood flow by relaxing and dilating veins and arteries, including the coronary arteries. Example: nitroglycerin and isosorbide dinitrate. Side effects. Side effects. The most common side effect of nitrates are headache, lightheadedness, flushing, or increase in heart rate. Beta blockers. Beta blockers reduce the heart rate, blood pressure, and the force of contractions, thereby decreasing the amount of oxygen the heart requires to pump blood. Example: atenolol, metoprolol, nadolol, and propranolol. Side effects: cardiac effects, worse heart failure and bradycardia. Non-cardiac effect: constrictions of airways, circulatory problems, impotency, hallucinations, insomnia, and fatigue. Calcium channel blockers. Calcium channel blockers dilate arteries and low blood pressure, which decreases the force of contraction. They also dilate veins, reducing amount of blood returning to the heart, which reduce the workload of the heart. Example: amlodipine, nifedipine, nicardipine, verapamil, and diltiazem. Side effect: flushing, dizziness, lightheadedness, headache, peripheral edema, depression of cardiac functions. Other measures in managing coronary artery diseases that are anticoagulants. Aspirin. Aspirin helps to prevent blood clotting, keeping the narrow arteries open and lowering the risk of a heart attack. Treat high blood pressure. Treat high cholesterol. Quit smoking. Lose excessive weight. Reduce stress. Exercise regularly. Other treatment options: precautionous, precocious coronary intervention, previously called angioplasty or balloon angioplasty, thus coronary artery bypass graft surgery. You can see a coronary bypass art graft surgery in a image where the part of the artery which is blocked is cutting out and it is attached by the another part of the artery, that is calling a percutaneous coronary interventions. Next, atherosclerosis. Atherosclerosis, also known as atherosclerotic vascular disease, artery wall thickness, buildup of fatty materials such as cholesterol, affecting arterial blood vessels, a chronic inflammatory responses in the walls of arteries due to the accumulation of macrophages promoted by low density lipoprotein without adequate removal of fats and cholesterol from the macrophages. Hardening or furring of the arteries, formation of multiple plaque within the arteries restrict blood flow. These plaque can also burst, causing a blood clot, often considered as a heart problem. Affect arteries anywhere in your body. Atherosclerosis is a preventable and treatable conditions. Terms: atherosclerosis is a general term describing any hardening and loss of elasticity of medium or large arteries. Atherosclerosis is any hardening of arterioles. Atherosclerosis is a hardening of an artery, especially due to an erythematous plaque. Erythrogenic is used for substances or processes that cause atherosclerosis. Atherogenesis is the developmental progress of erythematous plaques. Causes: atherosclerosis start with damage or injury to the inner layer of an artery. The damage may be caused by high blood pressure, high cholesterol, an irritant such as nicotine, certain disease such as diabetes. Epidemiology estimated 10-year risk of coronary artery disease according to various combinations of risk factor levels expressed as the probability of an event in 10 years. According to United States data for the year 2004, for about 65% of men, 47% of women, the first symptom of atherosclerotic cardiovascular disease is heart attack or sudden cardiac death, death within an hour of onset. Atherosclerosis is less preventable in Central and South America, Africa, and Asia, and more prevalent in United States and Japan. The mortality in US is 5 times higher than compared to Japan. Now, pathophysiology of atherosclerosis. Atherosclerosis develops as a chronic inflammatory response of the arterial wall to endothelial injury. Lesions progression occur through interaction of modified lipoproteins, monocyte-derived macrophages, T lymphocytes, and the normal cellular constituents of arterial wall. The contemporary view of atherosclerosis is expressed by response to injury hypothesis. Now, response to injury hypothesis. The following are steps involved in hypothesis: chronic endothelial injury, accumulation of lipoproteins, monocyte addition to the endothelium, SMC proliferations, and ECM extracellular matrix production, factor release, platelet addition. Now you can see a pathogenesis of atherosclerosis, a hypertension, hemodynamic stresses, toxins in cigarette smoke, high level of low density lipoproteins. They create a damage to endothelium, which further causing the platelet addition, which further makes the PDGF release, followed by proliferation of myointimal cells that causes collagen synthesis. Whereas, in addition, diffusion of plasma proteins to intima occur, followed by oxidation of low density lipoprotein that uptake to the migration of monocyte into intima, formation of form cells causing a cytokine release. So this is the process of pathogenesis of atherosclerosis. Now, in a monograph of an artery that supplies the heart with significant atherosclerosis and marked luminal narrowing. You can see a difference in this image. Symptoms. Atherosclerosis develops gradually, typically begins in early adolescence, and is usually found in most major arteries. No atherosclerosis symptoms until an artery is so narrow or clogged. Sometimes a blood clot completely obstructs blood flow or even breaks apart or cause heart attack or stroke. Symptoms. Atherosclerosis symptoms depend on which arteries are affected. For example, atherosclerosis in heart arteries have symptoms similar to those of the heart attack, such as chest pain, that is angina. Atherosclerosis in the arteries leading to brain have symptoms such as sudden numbness or weakness in arms or legs, difficult speaking or slurred speech, or dropping muscles in face. Atherosclerosis in the arteries in arms and legs produces decreased blood flow, is called peripheral artery occlusive disease. Have symptoms such as leg pain when walking. Sometimes atherosclerosis cause erectile dysfunction in men. Physiologic factors that increase risk. Various anatomic, physiological, and behavioral risk factors for atherosclerosis are known. These can be divided into various categories: modifiable and non-modifiable. Modifiable: having diabetes or impaired glucose tolerance, dyslipidemia, unhealthy patterns of serum proteins carrying fats and cholesterols. Tobacco smoking increases risk by 200% after several EPAC years. Having high blood pressure on its own increasing risk by 60%. Elevated serum C-reactive protein concentrations. Physiologic factors that increase risk. Non-modifiable: under this one, advanced age, male sex, having close relatives who have had some complications of atherosclerosis, genetic abnormalities such as familial hypercholesteremia, lesser or uncertain symptoms such as being obese, in particular central obesity, a sedentary lifestyle, postmenopausal estrogen deficiency, high carbohydrate intake, elevated serum levels of triglyceride, elevated serum lipoprotein concentrations, stress or symptoms of clinical depression, hyperthyroidism, elevated serum insulin levels, and short sleep duration. Complications. The complications of atherosclerosis depend on the location of the blocked arteries. For example, coronary artery disease, carotid artery disease, peripheral artery disease, particularly in arms and legs, aneurysms anywhere in body, formation of bulge in arteries. Test and diagnosis. Doctors may find signs of narrowed and large hardened arteries during a physical exam. These include a weak or absent pulse below the narrowed area of the artery, decreased blood pressure in the affected limb, woozy sound over the arteries, heard with the stethoscope, signs of the pulsating pulse in the abdomen or behind knee, evidence of poor wound healing in the area where blood flow is restricted. Further, blood tests, lab tests can detect increased level of cholesterol and blood sugars that may increase the risk of atherosclerosis. Doppler ultrasound. Use a spatial ultrasound device, that is calling a Doppler ultrasound, to measure blood pressure at various points, long arms or legs. These measurements can help doctors gauge the degree of an blockage as well as the speed of blood flow in the arteries. Ankle brachial index. This test can tell if anyone have atherosclerosis in the arteries in your legs and feet. Doctors may compare the blood pressure in ankle with the blood pressure in the arm. This is known as the ankle brachial index. An abnormal difference may indicate peripheral vascular disease, which is usually caused by atherosclerosis. Electrocardiogram. An electrocardiogram records electrical signals as they travel through your heart. An ECG can often reveals evidence of a previous heart attack or one that's in progress. Angiogram. To better view blood flow through heart, brains, arms, or legs, doctor may inject a special dye into arteries before and X-ray. This is known as angiogram. The dye outlines narrow spots and blockages on the X-ray images. Other imaging tests. Doctor may use ultrasound, a computerized topography that is also calling a CT scan, or a magnetic resonance angiogram that is calling a MRI, to study the arteries. These tests can often show hardening and narrowing of large arteries, as well as aneurysms and calcium deposits in the artery walls. Now let's discuss about the treatments and drugs. Lifestyle changes such as eating a healthy diet and exercising are often the first line of defense in treating atherosclerosis. Sometimes medication or surgical procedures may be recommended as well. Various drugs can slow or sometimes even reverse cholesterol medications, aggressively lowering low-density lipoprotein cholesterol, and the bad cholesterol can slow, stop, or even reverse the buildup of fatty deposits in arteries. Boosting high density lipoproteins, cholesterol, and good cholesterol may help too. Cholesterol medications include drugs known as statins and fibrates. Antiplatelet medications. Doctor may prescribe antiplatelet medications such as aspirin to reduce the likelihood the platelets will clump in narrow arteries, form a blood clot, and cause further blockage. Anticoagulant and coagulant such as heparin or warfarin can help thin blood to prevent clot from forming. Blood pressure medications. Medications to control blood pressure such as beta blockers, angiotensin converting enzyme inhibitors, and calcium channel blockers can help slow the progression of atherosclerosis. Other medications such as diabetes, leg pain during exercise are prescribed. Symptoms or a blockage that threatens muscles or skin tissue survival may be a candidate for one of the following surgical procedures. Angioplasty. In this procedure, doctor insert a long, thin tube that is called a catheter into the blocked or narrowed part of artery. A mesh tube that is also called a stent is usually left in the arteries to help keep the artery open. Angioplasty may also be done with laser technique. Endarterectomy. In some cases, fatty deposit may be surgically removed from the walls of a narrowed artery. When the procedure is done on arteries in the neck, that is the carotid artery, it's known as carotid endarterectomy. thrombolytic therapy. If have an arteries that's blocked by a blood clot, doctor may insert a clot dissolving drug into the arteries that at the point of the clot to break it up. Bypass surgery. A doctor may create a graft bypass using a vessels from another part of body or a tube made a synthetic fabric. This allows blood to flow around the blocked or narrowed artery. Lifestyle changes may help prevent or slow the progression of atherosclerosis. Stop smoking, exercise most days of the week, eat healthy food, manage stress, manage the condition of high cholesterol, high blood pressure, diabetes, or other chronic diseases. So these are the references. So like that we have completed in this chapter about the basic introduction of angina, various types of angina, what are the risk factors of the anginas, what are the symptoms, pathophysiology, a pathogenesis, and a small information about the treatment of the angina. Then we discussed about the atherosclerosis, a pathophysiology of atherosclerosis, what are the various risk factors, what are the causing factors of atherosclerosis. Then we discuss about the small information on the treatment. Now, in our next lecture, we will discuss about the pharmacological treatment of the angina pectoris. Thanks a lot.